Let's try to get a call in here before the break. Irene from San Leandro. Good morning, Irene.
Good morning.
Your question for the doctor?
Yeah, my question is, what is the recovery time? You know, from
Sure.
the time he does the tummy tuck, and you can go back to work and be normal.
Yes, it also is variable. I'd say most patients, the first couple days, they need to be at home, just taking it easy, really not doing too much. By the end of the first week, a lot of them are now getting around, getting up, moving all by themselves without too much trouble. By the end of 2 weeks, they're back to doing what they want. Now, I have some patients who push the envelope, and in a week, they're wanting to do everything that they can. And if you don't have a job that requires a lot of heavy lifting and that sort of stuff, then it's okay. I find the hardest part is most of my patients have been pregnant recently, so they have 2, 3, 4-year-olds, and they can't lift them up. So sometimes arrangements need to be made to help with that too. But usually by a couple weeks, people are back to doing the majority of what they were doing before. By 6 weeks, all the restrictions are lifted, and that includes the heavy lifting.
Okay, Irene, is this something that you're considering? Oh, I guess we lost Irene. So yeah, you mentioned an important point. If you're doing it because you've just had children,
sure,
you've got little ones running around, I mean, how do you guarantee that you're not going to, you know,
sure,
cause damage after the surgery?
Yeah, I mean, the best thing is having some help, but if the children are smaller, then it's easier, you can lift them up. If they're bigger, a lot of times they don't need to be lifted up, but if they're used to it, it's good to sort of broach that subject ahead of time.
Certainly, and ask for some help.
And most of my patients take care of that. Most of my patients are already thinking, they've had friends who've had the procedure, they've seen them go through it, they have some sort of idea what's going on.
All right, we need to take a quick break, but for more information about Dr. Mealy, you can call him 925-943-6353 or check him out on the web at drmealy.com or San Francisco Plastic Surgery blog.com. When we come back on Body Beautiful, we'll wrap up our chat about tummy tucks with Dr. Mealy, and we'll take some more of your phone calls. Welcome back to Body Beautiful. We'll be taking your calls with any questions you might have about tummy tucks. Here's the phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment, so be ready with your pen and paper to jot that down. And also, if you are planning any procedure like this, you certainly want a second opinion. So we're offering all kinds of good information, and Dr. Mealy is one of the top plastic surgeons around. But
it's good general information, but when it comes down to the individual patient, sometimes things change a little bit.
Yep. We had a lot of calls about age requirements and if there are any, certainly after pregnancy,
sure,
how long you want to wait. I mean, ultimately, who's a good candidate for a tummy tuck?
A good candidate is someone who's in good health, so they have good health, hopefully have had a recent physical examination, and who have the types of things that the procedure can repair, and that's where getting a good first or second opinion comes in, because there are some things that procedures fix and some things that procedures can't fix, and the folks who have that fullness at the lower part of the abdomen where the baby usually sits and stretches things out tend to be good candidates for tummy tucks.
And we talked earlier in the show about mini tummy tucks, and can you just recap that for a moment, because
sure,
not everyone is a good candidate for the mini.
Right, it's much more selective because everything from if everything from the belly button up looks good, then they may be a good candidate for a mini tummy tuck. They may be a candidate for just liposuction too. It's the folks who have the looseness of the muscle below the belly button, some extra skin there that's going to fold, but above the belly button everything looks good. They can go with the mini tummy tuck and recover much more quickly. Okay, and we asked this, but can a tummy tuck actually relieve back pain? I get asked that a lot, and I have had quite a few folks who have chronic low back pain. Their muscles are sort of stretched out, and what happens is the muscles don't just stretch forwards, they kind of spread apart. And when I'm repairing that, I'm bringing the two muscles back together, and I try to overlap them just a little bit, which is the normal configuration. And I think it does kind of help give support to that abdomen. Now, the procedure's not really designed to get rid of back pain. So if someone has a disc, they have something going on in their back, it's not going to help. But if it's muscle weakness, I have seen it help. Okay. I just can't guarantee that one, though. Okay, all right, but so are you talking, I mean, does this strengthen the muscle? The muscle has to be strong, but it just gets it into a better position so it works more efficiently. Okay, what about special garments? I do have you wear a garment, and if you're having a tummy tuck, usually about 2 weeks you'll wear a garment day and night that's like a big Velcro strap that goes around, and then I try to get my patients to wear it half the time for another 4 weeks. and that's helpful. I think what that'll do is give them some support. So at the beginning, they're very happy to wear it because they feel good. It also gets the swelling down. It also allows that skin to adhere to the muscle so we don't get any fluid collections or problems.
Okay, I'm going to throw this really quick because we're running out of time. But those garments, outer garments called Spanx or girdles or things like that, are those good to wear for your muscles, or this is totally coming out of left field?
No,
but
I had some patients change from what I've given them to Spanx or something along those lines. They don't provide as much compression, so it's not as focused.
Okay.
But it is helpful.
All right, thanks.
Yeah.
Thanks for answering that one.
I think of it whenever you're moving with those on, you're getting
Yeah.
a little massage and helps that scar
All right, well, good.
smooth out.
Thank you very much, Doctor. Unfortunately, we are out of time. Dr. Mealy, for more information, you can call Dr. Mealy at 925-943-6353 or check him out at the web at drmealy.com or at sanfranciscoplasticsurgeryblog.com. Thanks so much for joining us. Have a good day, everybody. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.